Hello and welcome to our digital broadcast where we focus on Omicron. I'm Sneha Mordani. Today we will tell you about the expected trajectory of the pandemic and what India can learn from South Africa, the country that first identified the fifth variant of concern. I spoke earlier to the doctor who first raised an alarm over Omicron. Listen in to what she had to say. Dr. Coetzee, some countries are mulling over circuit breaker lockdowns. India too has sent out a fresh set of guidelines to the states talking about how night curfews must be imposed. I think all of us here in India are sort of getting ready for some restrictions in the beginning of the new year. Do you think that's a way to go forward, at least for a circuit breaker lockdown, and that is advisable? Has South Africa done something of that to that effect?
Okay, so South Africa, what we have done, we again enforce the masks to be wearing. We are asking people to stay away from big gatherings, and we are urging people to get their vaccines or booster shots. But the booster shots will start for the average public the beginning of January. So that's what we ask them. So we keep an eye on the developments and the numbers and the ICU cases. So at this stage, except for closing, especially indoor gatherings of like churches and those type of things, where there's a lot of people normally in a small space which is normally also not very good ventilated. We haven't done anything else because it's difficult. The virus is everywhere, and you just need to mitigate it. You need to use caution what you are doing. I'm always saying you need to use your common sense. And we're telling you the masks, we are telling you stay away from crowds, we are telling you get your vaccines, and that's what you need to do.
Okay, so any sort of night curfew or any restrictions vis-a-vis some sort of a lockdown, closing down of markets, that per se you're saying is not going to work in the case of Omicron?
It's already everywhere. That's why it's difficult. So what we have done, we do have a curfew. 11 o'clock at night, all the restaurants must be closed, and until 4 o'clock the next morning. So that we do have in place, and we do have in place restrictions on gatherings, but still, outside 2,000, inside indoors 750. It's still a lot of people. So that's something that we keep on saying. Please, we need to look at that, and maybe get less people. Especially indoors.
Yes.
But more than that, South Africa hasn't done anything else. As we said, at some stage we need to learn how to live with this virus as well. And if our numbers are in hospital increasing, that hospitals can't take the strain, that's when we will step in again. So for us, it goes about, can the healthcare facilities cope? As long as the healthcare facilities can cope, and the doctors, and we can protect our doctors,
yes,
we're not going to bring in any other curfews or any other restrictions.
Dr. Coetzee, do tell us, in the last 3 weeks, ever since you all found out about Omicron, what has been happening in South Africa? How has the situation now changed as of today?
So good morning from South Africa.
Yes, good morning, doctor.
We in South Africa, yesterday we had a higher number of patients testing positive. However, again, it seems as if we are in Gauteng, past our curve for now. The numbers are coming down. Maybe coming beginning of January, we might see a surge again when people come back from their Christmas leave and coming back to work in Gauteng. We are seeing a bit of an increase in numbers in KwaZulu-Natal, because that's where our people mostly go and have holidays, as well as in the Western Cape. For now, again, the hospital admission rates are still of such a manner that we are not overburdened, and our ICUs are still not overburdened as well. Most of the patients in ICU is unvaccinated, and the majority of patients still have mild symptoms. As we have seen, this is now our fifth week. From a clinical perspective that we are looking at this.
Yes. From what you just told me, do correct me if I'm wrong, are you suggesting that the hospitalizations also right now seem to have come down?
Our hospital admissions is more or less stable. It is. It is. Let me just say to you that yesterday it was 663 patients across 660 facilities. And then the previous day as well, we didn't have high numbers.
Joining us today is Dr. Venkat Raman Kola. He is a clinical director at Yashoda Hospitals in Hyderabad. Thank you so much, Dr. Venkat, for your time here. I want to begin by asking you that it does appear that cases increase and decline rapidly. That's what the trajectory is. But does that mean that we can sit back and relax when it comes to Omicron? Because a lot is being said about lesser hospitalizations and also about this infection being mild.
Yeah, I think that's a good part of it, that we are seeing a milder variant of cases, not many hospitalization, not many sick patients, not many ICU admissions particularly. But saying this, I should warn all of us, the infectivity is extremely high. What we have been dealt with all throughout the COVID is the infectivity, the number of cases surge in at a time. If you look at any city, if you have a crore population, if 10% of them get infected, it comes to around 10 lakhs, and even 1% of them get hospitalized into ICU, it will be 10,000. You will be overwhelmed. So a country like India cannot relax. So we are looking at a variant. Every country is now seeing a surge everywhere. From South Africa, you see UK, US, or any other countries, most of them now are seeing a surge. So the infectivity, transmissibility looks very high with the current mutation and current information. So we expect a stiff surge of number of cases. Yes, when the case number goes to lakhs, like what we have seen with Delta, 5 lakhs, 6 lakhs in a country like India, then your hospitalization, even though 1%, 10% of them needs hospitalization, 1% needs ICU, that will be overwhelming. See, we can't take things granted, saying Omicron looks more milder variant. We are happy with that. But in the same time, it also can kill. We have seen the mortality 8 to 9 already in South Africa. We have seen the first death from Omicron from United States of US. So this will be a phenomenon. So even a smaller percentage in this large infectivity will be counting. So we have to be careful.
Yes.
We can't relax and put our guards down.